Dental implants are much more common nowadays, and that trend is only going to continue. And with more and more implants being placed, we're seeing more and more complications arise. And I think this comes from patients not being prepared, but also there's a lower barrier to entry for some clinicians to be able to place dental implants. So all of these complications are preventable, but you have to be asking the right questions and find the right providers. So here's an example. I had seen a patient last week who 2 years ago thought that they had found a great bargain for some dental implants. They were going to get 3 dental implants placed and restored. And now, 2 years later, when I seen them last week, the implants are loose. They're giving quite a bit of trouble. And now it's going to cost about 3 times as much to fix everything. So why does that happen? And I think it comes down to 2 things. People have this preconceived thought that because I have metal now that can't decay, and that's not necessarily true. So they get into this, I can set and forget, and I'm going to have these teeth for the rest of my life. And the same way that you can get gum disease around your own natural teeth, you can get gum disease around your implants. And it's something that's called peri-implantitis. It's a type of infection that is very silent, but can also be very aggressive, that will lead to bone loss around your implants that will eventually, like your natural teeth, cause them to get loose and fall out. So perhaps patients are being sold on the idea of having this great smile and getting their teeth back again, and they tend to ignore the maintenance or the science behind the implants as well. Or maybe they're just not informed about it at all. So I will always say to patients, if you're not going to look after these implants the same way that you would look after your own natural teeth, or even looking after the implants better, then don't bother getting them at all. So if you are seriously considering getting implants, you have to ask the hard questions. You owe it to your future self. Go and ask these questions and protect your investment. So here are 3 things that I would encourage you to ask when you go and talk about dental implants. The first kind of area of question would be, how many implants have you placed? How often do you place them? What is your success ratio like with dental implants? And is there anything in my medical history that might complicate this procedure? And that last question about your medical history is quite an important one. Particularly, just thinking of 2 things off my head would be diabetes, particularly uncontrolled diabetes, because that's going to impact the way that you heal after a surgical procedure, and also osteoporosis. Because again, we're dealing with the bones, we're putting something into the bone and we're expecting it to heal around the bone, and osteoporosis can get in the way a little bit if we are planning on doing that. And also, don't be afraid, go and take notes and write down the things that they tell you and go ahead and research them afterwards. Again, you're going to be spending thousands of dollars, pounds, euros, whatever it is. You want to know what you're getting and you want to be able to protect that investment. The next thing I would ask them is, are we going to do a CBCT scan of the head and neck? This is essentially a 3D X-ray that lets them see all of your jaw, how thick it is, how deep it is, if there's any other structures, nerves, blood vessels and things like that would be around the area that they're going to place the implant. If someone is making these decisions based off a 2D flat X-ray, then that's a little bit of a red flag, unless this is a very simple, straightforward implant case where something like that, it wouldn't be necessary to expose you to extra X-rays just for something that would be so straightforward. So for a more complicated case, definitely if they're not going to take a CBCT, I would just leave. One of the most important things for you to ask or to seek is, do they have a follow-up program or protocol, or how should you look after these implants when they're placed? And this is something you should be finding out before you've had the actual procedure done, because if they don't have that hygiene program or protocol set up already, then I would say they're not set up for your future success with these implants. And look, implants are fantastic technology, but they're only really good when they're done by someone who knows what they're doing, and if they're maintained by someone who also knows what they're supposed to be doing. So don't let good marketing fool you. Yes, you can replace all of your teeth, but you need to know exactly what you're getting yourself into. If you don't prepare for this completely, then I would be concerned that you're only setting yourself up for what could potentially be a dental nightmare that could take years to fix. So protect your investment and stay informed.